Hi there, everybody. I'm Jeff Mayers from wisppolitics.com and wispbusiness.com, here today with a virtual program with top healthcare leaders from around the state. And we're going to look at lessons from the ongoing pandemic. First off, some notes for people listening in here. Some upcoming events other than this one, 2 in-person events coming up next week. On the 21st, we're going to have our annual polling summit, and that's a evening event, and you can find out details about that at wispolitics.com. Then on November 18th, we're going to do a program in person at the Madison Club on redistricting. So that's a controversial topic, and we have a good panel, and you can find out details about that and register at wispolitics.com. Today, we're talking about healthcare, and you can sign up for our free daily healthcare newsletter, the Healthcare Report, and you can sign up for that at wispbusiness.com. Now, on to our event today. We want to thank our sponsors for this event, first of all. The Wisconsin Healthcare Business Forum, which helped us promote this event, the Wisconsin Hospital Association, Xcel Energy, Walmart, American Family Insurance, Hush Blackwell, and AARP Wisconsin. So as I said, the program today is about the ongoing pandemic, and we have an all-star panel to help us understand the lessons we've learned and maybe some of the lessons we haven't learned and what we should anticipate going forward. We have Karen Timberlake. She's the Secretary of the Wisconsin Department of Health Services. We have Chris Woleske. She's the President and CEO of Bellin Health. We have Dr. Susan Turney, CEO of Marshfield Clinic Health System, and Dr. John Raymond, President and CEO of the Medical College of Wisconsin. Thank you very much, panelists. And the format for this is I ask some questions at the beginning, and then we go to some questions submitted by audience members. And then we'll conclude around 1 o'clock. So let's just start off by trying to answer the question. It's sort of an opening statement, don't go on too long, but try to answer the question posed in the title of the program, Lessons Learned from the Ongoing Pandemic. Let's start with Dr. Turney of the Marshfield Clinic. Welcome, Dr. Turney. And what sort of lessons do you think we've learned so far in this pandemic?
Well, Jeff, thanks. And, the list is quite long, I would say. Most of us have learned a lot through this journey about human nature and certainly its potential and pitfalls. I think one of the things that we saw was the incredible adaptability in the way we changed how we worked and how we provided care. And, it even transcended into how we lived our lives. So the good thing is we saw how ingenious we can be, especially when we work together. And really, there's no better example of that than developing the incredibly safe and effective vaccines in record time. But, there's a downside as well. We did see many of our frailties. We saw people's instinct towards tribalism. We saw a loss of faith in science and expertise, and certainly we're isolated from each other. And we also saw and still are witnessing the mental health issues skyrocket. It's become very obvious through many of the inconveniences and the true perils of this pandemic that the issues fell disproportionately on the poor, the elderly, certainly folks in isolated rural areas like ours, and, as well as under-resourced urban communities. So, when people are being paid the least were deemed essential workers and they were taking on some of the most risk, it created many fault lines, I think, that are now very obvious in our society. And it really revealed the inequities that we have been aware of, but have been magnified as we might have been complacent about many of these things in the past. So I would say that I have a lot of hope. I am a very hopeful person. And I think that we can take a humanistic lesson from all of this. I think we are seeing that the division and that the discord are not only unpleasant, but they're ineffective, and that there are certain groups or individuals in our society that are coming together and aren't going to tolerate those who are disadvantaged, for example, just because they live in a certain zip code. But I think this reset, the approach we have, and the good faith we have towards each other, and again, thinking about the common cause, and I think we can be stronger together. And I think many of those actions are underway. I think the movements to address the inequity, I think we have made it a strategic imperative of our health system. We are putting resources and staff to this area, and it's front and center. And it's front and center for our providers, our staff, and our communities. So I think we're going to see similar movements happening in organizations across our great state, across the country, and shines that ray of hope that we need during a long 18-month journey fighting the fight.
Yeah, and we should tell people the large swath of the state that Marshfield occupies, and now expanding into the Upper Peninsula even too. So, I mean, give us a geographic range, just so people, if they don't know about Marshfield.
Sure. I thank you. We are mostly in the northern 2/3 of the state of Wisconsin. Just announced a partnership with Dickinson up in Michigan yesterday, but we cover about 45,000 square miles. And we do serve a population that tends to be older, sicker, and poorer than the population across the rest of the state. We're rural. And we're very proud that we have figured out how to manage care across these geographies with a fully integrated system with providers, with hospitals in our health plan.
Okay, thank you, Dr. Turney, and we'll be back with some more questions, so hang on. Okay, now we want to go to Chris Woleske. She's the president and CEO of Bellin Health in the Green Bay area. And why don't you tell us about your market area too, Chris, and then go into the answering the question about what you think some of the lessons learned from the ongoing pandemic are.
Sure, thanks, Jeff. So Bellin Health is located in Northeast Wisconsin and the Upper Peninsula of Michigan. We've got about 40 locations in that geography. And, we're seeing many of the same issues that Susan spoke about in terms of the mental health issues. There is just not enough providers in the state or in the nation really to meet the needs across the nation, especially given the impact of the pandemic. And it is something that I think we really need to own and make sure that we're talking about it every chance we get, because there are things that we can do to improve access to care and mental health. Some of the lessons learned. So Susan did, I think, a great job taking a big picture view of some of the lessons. And maybe I'll drill down a little bit and just talk about lessons learned within organizations and not just my own, but talking with other CEOs and other businesses. One of the things that the pandemic did that I think is a really big positive is it exposed in the organization visibility to real talent and real dedication within our own organizations. People who, they did their jobs every day and they were good at it. And then when we faced something like this, they really rose to the challenge. And so we at Bellin in particular have identified people who are the next leaders in the organization, the shining stars, the people who are great at problem solving, people who are great at communicating, people who are willing to step into an unknown and uncertain virus like COVID-19 and say, I'll take this risk and I'll take care of these patients. That's really good insight to have in your own organization. And that's a gift that I'm very grateful for personally. I think the other lesson is we all know how important communication is, but in the face of so much uncertainty, I think communicating about what we know and acknowledging what we don't know is a comfort to people. And that became very, very obvious. I also think we learned that work can be done remotely. And that includes even some healthcare services that previously there may have been a reluctance to say that we can do that just as well with technology as we do it with hands-on. And we're making some progress in that regard. And I think that that's going to be very helpful to better access to care for many people. And then finally, I just want to give a shout out for public health. One of the things that I hope that we all learned in this is that our public health departments and officers are very, very important to us. And the time to get to know them and to show them that we value them isn't in the middle of a pandemic, it's much before that. And so the gift, again, for our organization has been to really get to know our public health department as colleagues and partners and associates. And my hope is that we continue to build that relationship and continue to advocate on their behalf and work to give them a more of a voice in what happens with public health.
All right. Well, speaking of public health, let's go to the Department of Health Services Secretary Karen Timberlake. Welcome, Karen. And what do you see as the lessons learned so far in the pandemic from the state and the department's point of view?
Yeah, thanks, Jeff, and pleasure to be with everybody today. I really appreciate, Chris, the shout out for public health, and I'll pick it up right where you left off and turn the thanks back to all of you as well. I think one of our key learnings throughout this pandemic has been the need to tap into all available resources, human capital, financial resources, organizational presence, relationships that others have that we may not have. And in particular, the need to embrace and really continue to build some of those non-traditional partnerships. There is no way to have gotten to a place in our state where we have vaccinated over 6.4 million people. We are testing tens of thousands of people every week. We have 73% of the public school districts in our state participating in our school testing program. All of this is work that no one was doing 18 months ago, right? And so there's no way to have gotten to that place and that level of a response without certainly the backbone of our public health partners around the state, but also the leadership and the contributions of our major health systems and our pharmacists and our community leaders, faith leaders, community organizations, all of us who really are in it together. So that's been a key learning for us, and it's a key ongoing part of the response. Next thing I'll highlight certainly is that we have to be reminding ourselves that we're not quite out of the woods yet. I know we'll spend more time on the data, Jeff, a little bit later, but we're still in a place where we're identifying more than 2,000 new cases of COVID every single day. We're in a place where we have more than 1,100 people hospitalized across our state with COVID today. We have lost 100 people in the state of Wisconsin to COVID since October 1st. And so the fact that this is an ongoing pandemic, creating ongoing challenges, we're all completely sick and tired of it. And yet we have to continue to gear up and innovate and respond and be able to tap in to that next reserve, whether it's a frontline healthcare worker, whether it's a person still wearing a mask in their workplace, whether it's a child being tested at school. All of those things are part of that ongoing persistence and commitment to getting through this together that we really do have to see each other through. Last thing I'll highlight is we also really have learned about the need for the response to the pandemic to continue to be adjusted and customized and varied to the many different people in our state and the many different parts of our state, right? The market that the Marshfield Clinic serves is different from Bellin, is different from the medical college, is different from what things look like here in Dane County. The local resources are different. The local relationships are different. The tendency of some of the leaders and individuals in those communities to trust or to not trust public health, to trust or to not trust government, to trust or to not trust healthcare and science and experts. All of those things are widely varying just within the state of Wisconsin. And so we have to continue to be nimble and adaptable and customize what we do so that at the end of the day, we are reaching everybody with information that they can understand and use. We are removing barriers to the services that people need to understand and respond to COVID. And we're doing everything we all can to keep our entire state as safe as we can.
Okay, you're right. We'll be back on some of these on the data points. Okay, let's go to Dr. John Raymond. He's the president and CEO of the Medical College of Wisconsin. in the Milwaukee area. So welcome, Dr. Raymond. And what's your answer to the question about what are the ongoing, what are some of the lessons from the ongoing pandemic?
Thanks, Jeff. And I do want to point out that MCW also has campuses in De Pere and Wausau, and that we partner with Bellin Health and Marshfield Clinic to deliver medical education throughout the whole state. The other panelists have really given some outstanding insights. And I would say that the pandemic has brought out the best and the worst in all of us. And for the best, I would say the ingenuity, the resilience of our frontline healthcare workers, of essential workers, of people in the manufacturing sector, the hospitality sector, have really been uplifting for me. And also the unprecedented level of cooperation amongst health systems that compete in the same markets has just really been something that I think all of us can be tremendously proud of, and has helped Wisconsin fare better than most other states in terms of the surges that we've had. Just in terms of the worst of us, I think the politicization of public health interventions has not served us well. In fact, it's created an environment in which we feel like other people are the enemy, the other tribes, I think Susan mentioned tribes, rather than the virus being our common foe. And so in terms of lessons learned, I hope that going forward early in the next pandemic, that all of our government officials come together and depoliticize the conversation, that we work together for the common good, and that we recognize that a national level coordinated response is better than having each community decide how they're going to intervene, because the virus doesn't respect state borders and county lines. It goes everywhere.
So I want to stay with you, Dr. Raymond. You said the next pandemic. Man, we haven't even gotten through this one yet. And then here comes the flu season. Is this what it's going to be like? We're always going to be worrying about what's next, while grappling with what we have, or, do you have any hopeful comments about that? Or is it like, be on alert, everybody?
Well, I think it's incumbent on all of us to take the lessons that we've learned from the pandemic and carry them forward. And there's some simple things that we can do. We can protect our supply chains better than we did early in the pandemic here. And we have to recognize that the just-in-time supply chain that depends on raw materials and manufactured goods from all over the world is very, very fragile. So there may be a turn to local production of critical resources. Hopefully we'll beef up our stockpiles, and we should invest in proactive research and modeling for potential human pathogens. And I think what is very likely to happen is we're not going to have a 100-year interval between the Spanish flu and the COVID-19 epidemic. I think that's almost a certainty. We have more people in the world, we interact with each other, we're more dependent on each other. So we can do a better job being prepared. I also want to say that messenger RNA technology being deployed for vaccine development is breathtakingly good. This is something that we can deploy very quickly going forward. The limiting factors on these vaccines early in the pandemic was proof of principle and lack of a turnkey manufacturing capacity. Now we've proved the principle that these vaccines can work beautifully, and we have a ready-made manufacturing capacity that we can deploy very quickly for the next pandemic.
All right, well, let's talk about the vaccines. And, I'll go first to Secretary Timberlake. The vaccination rate in Wisconsin seems to be behind that of other states overall, compared to the national rate. What's your explanation for why our vaccination rate isn't higher than it is?
Yep. So certainly we saw that we started out very strong. We were national leaders for a period of time in the rate of people getting vaccinated. We still do extremely well nationally in our overall efficiency of administering all the vaccine that we take into our state. So again, that's a credit to the vaccinators who I'm looking at on the screen and their partners all across the state. We are actually in the middle of the pack right now in terms of our overall vaccination rate. And I think what you are seeing in our state, as is true in many states, is people's tendency to get vaccinated is determined by a lot of factors. And there are some that we can control, and we feel that we've done a good job of addressing what we can address. And there are other factors that are maybe not so much within our control. So what I mean by that is one of the things we can control is making sure that we've got as many points of access and points of availability of the vaccine as we can possibly have across our state. So far this week, we've had over 700 different places across our state that are administering vaccine. In some weeks, that number is up above 1,000. So we have lots and lots and lots of points of entry. We have a great deal of information going out and available to people. And yet some of the barriers that we know still exist for people can relate to, again, their tendency to sort of trust the information, trust the science, understand the, remarkable achievement that we really are looking at here with these 3 very safe and effective vaccines. We have some ability to influence that through the messaging and the communication that we do. We rely heavily on our clinical experts, on our media partners, on others in the sort of overall vaccine network, if I can call it that, to be communicating that information and reaching out to people with those trusted messages at times and places that they are ready to hear them. Last thing I'll say is that we, like other states, definitely did see some uptick in people's interest in vaccine with the advent of the Delta variant. And we also obviously caused some additional interest to occur with the governor's vaccine incentive and reward program. What I think we're now seeing nationally that I think we all need to be paying attention to is the Delta variant is causing people to still be interested in vaccination. Pressure on our hospitals and our health systems is resonating for people as a reason to get vaccinated, and that continues to be true, as I noted earlier. And personal experience with a friend, a family member, a loved one who has been affected by COVID. All of those things are now what is drawing that next sort of tier of folks across the line to get vaccinated. And so we all would hope it wouldn't take a personal experience and certainly a tragic experience to cause people to pay attention. But I think that that's instructive for all of us in terms of how do we tap into that sort of next round of what's catching people's attention, again, in this sort of overall environment of COVID fatigue that we're all living through.
Let me go to Dr. Turney now of the Marshfield Clinic. I mean, there appears to be a rural-urban divide in terms of the vaccination rates by county. Is that how you see it, or is it more nuanced than that?
It's likely more nuanced than that, but we clearly have seen the divide. I mentioned that our service area is pretty much all rural, and we have 2 of the counties in the state and that have the lowest vaccination rate, and they are in the heart of our service area. So, we have seen it.
And they are Taylor and what?
Clark.
Mm-hmm.
Yeah, Taylor and Clark. So, we've seen it, and we've lived very, very strong vaccine resistance. And I think you mentioned at the beginning that many of the health systems in the state have mandated the vaccine, and we did in our health system. And it did draw a lot of backlash from our communities. And like others, we had protests outside our facilities. We had providers and staff that have been harassed both in person as well as online for, doing their jobs. So it's frustrating, but, when we had to make the tough decision, it was something that we did based on our values, and our values demand that we are patient-centered and that we are committed to excellence. And our mission is to enrich lives. So we can't approach living up to those ideals if we have an unvaccinated workforce. So we do everything Karen mentioned around information, education, easy access, and talk to our patients and talk to our communities. But I don't know that I can answer that $1 million question as to what will be that breakthrough. And we're asking ourselves that every day, and we don't really have a great answer for that. But our patients do want, and they do deserve, to really come to a facility that does everything we can to keep them and their families safe and healthy. So we're going to continue down the path and look to our clinical colleagues and follow their lead during this journey.
Okay, so staying with you, Dr. Turney, so you mentioned that you had a vaccination requirement for your workforce, and how's that going so far?
You know, like I said, there's some people that support the vaccine and some that don't. Right now, a high percentage of our workforce are vaccinated, yet we won't know the final numbers until the date where we required complete vaccination series for COVID is completed. And we knew that we had to time it for the flu shot, which is something we've already mentioned, because the prediction is that this is going to be a severe flu season. So, you know, we do have employees who have had exemptions, and we do honor those exemptions, yet I suspect that we will lose some of our workforce as a result of the requirement that we put in place.
Okay, let's go to Chris Woleske. She's the president and CEO of Bellin Health. So Chris, in terms of, first of all, in terms of your organization, do you also have a workforce requirement for vaccination?
Yes, we do. We recently put that in place just a couple of weeks ago.
And how is that going so far?
Well, the due date is November 15th, so there's still a bit of time. Like Susan said, we allow exemptions, and we're going through the process now of processing the applications for those exemptions. Similar to the experience that Marshfield Clinic has had, we have some people who are very supportive of it and grateful that it's in place, and we have others that are not in favor of it and wish that we didn't have it. We spent a lot of time before we put the requirement in place, trying to help people understand the science and the reason that it's important to get vaccinated. And we made a lot of progress. Before we even issued the requirement, we were just about shy of 80% of our workforce being vaccinated. And we're now at 82.6%, so it has improved a bit. We know that there will be people that will fall under one of the exemptions, so we don't expect to get to 100%. We also know that we will have some people that will leave because of the requirement, and that's unfortunate because they're leaving, I think, one of the best organizations in terms of places to work. The work that we do is meaningful and purposeful. The people here take care of each other, and the community that we serve values our services and relies on us for their care. And so I just hope that people can find their way to come to terms with the requirement and stay with us.
Staying with you, Chris, it just seems very perplexing, I think, to a lot of people. Like, how could a healthcare worker not believe in vaccinations? Do you have an answer for that?
Healthcare workers are a reflection of society in general. I know that they've been called heroes and lots of titles given to them, and they are heroes in many, many respects, but they're human beings, and they have the same uncertainties, the same concerns that are reflected in society in general. And I've listened to them talk about it. For many of them, it's not science-based. For many of them, it is a lack of knowledge and understanding. And we've worked with those individuals to try to help them to understand and appreciate the science. If you're not trained in epidemiology and infectious disease, some of those studies that are out there can be very challenging. So I've asked our clinicians, our physicians who are trained in infectious disease and epidemiology to be the experts and to share their personal views and answer questions of our staff. And that's been, I think, very, very beneficial. Really appreciate them walking alongside us on this.
Okay, thank you. Let's go to Dr. Raymond, President and CEO of Medical College of Wisconsin. And so, Dr. Raymond, first of all, MCW has a requirement for its employees as well, right?
We do, and we're at 97% compliance. About 3% of the compliance is actually in 3 exemption categories, either religious or medical/disability exemptions. And we've granted about 100 of those. And then people that are able to work 100% remotely. And we have actually deactivated their badge access to our campuses. So that's about 3% of the workforce, 94% fully vaccinated. And the vast majority of our people believe in vaccination and are glad that we have mandatory vaccination. We have 186 people as of this morning whose status is unknown. And we've had about a dozen people submit resignations, mostly in support areas like public safety, our facilities area, and the animal facilities. And we're working hard with the last 186 people to answer their questions. As Chris pointed out, there's some uncertainties that people have. Not everybody comes to the table with the same trust in science or understanding of it, and we're trying to work with them. But at the end of the day, even though we don't want to lose anyone, we believe that our community expects us to provide the safest possible clinical care, working and learning environment for them. And part of that is, and people have directly said they want their providers to be vaccinated.
Okay, what's your view on, I'm the one who said rural-urban divide, and, and Susan said that was maybe a little too stark. I mean, what's your view on that question, Dr. Raymond?
Well, I think there is a lack of vaccine confidence in isolated rural communities, as Susan pointed out, and also in minority communities in urban areas. And the issues of the uncertainty about vaccination overlap, but they're not 100% identical. And one of the things that all the health system leaders have been trying to do is find ways to tailor our communications to the populations that we serve. And let's say that vaccine hesitancy in an African-American population may be based in part on justifiable mistrust of science and medicine from history. It may be different in a rural community where people have to work and they can't take time off to go get vaccinated, and they believe that vaccinations aren't necessary in their community. So I think, I don't think that there's a huge divide. And as Susan pointed out, people that are disenfranchised, that are economically disadvantaged, that don't have strong support networks, that may be required to be frontline workers, really don't have the same flexibility and ability to go get vaccinated. Just think about a single working mother with 3 kids at home who lives hand to mouth. Unless there's a clinic available on a day that she's off work and she can get transportation there, it would be very difficult to be vaccinated. So those are the kind of problems that we're all dealing with.
All right, Secretary Timberlake, what about getting to these, I guess, hard to vaccinate populations? I mean, what's the state strategy? Is it tailoring the message, but is it is it like take the mobile clinic in, or, I mean, it doesn't seem like there's an easy answer. It seems like it's an individualized approach.
Yeah, for sure, there is no easy answer. And so I'll go back to where Chris started us off with the reference to public health and how critical our local public health partners are, because they are the ones who know kind of right on the ground, what is it that's going to make the most difference in Sawyer County as compared to Brown County, as compared to anywhere else in the state. One of the things I would just note on the data, Jeff, is that we actually have about 14 counties in our state that I would consider pretty rural. People living there might not, that are ahead of the state's overall vaccine average. So I think it's right that it's important to really think about this as a very localized set of questions, and really down to the individual and their particular barriers. So some of the barriers that Dr. Raymond talked about in terms of time off of work, one thing we hear about quite a lot is concern about time off of work to recover, right? Everyone has heard that there are side effects to the vaccine. I might not feel great for a day or two. And if my employer doesn't give me paid time off, how do I accommodate that? The reality of it is, if you get COVID and you have serious side effects of COVID, you're of course going to be out of work a lot longer, but helping people process that information and kind of make that choice for themselves is really key. The other thing I'll note, I know I alluded earlier to some of the kind of non-traditional partners and partnerships. We have been very thankful not only of the vaccinations that our healthcare systems have provided, but also our pharmacies across the state who have just been critical partners with us. Our National Guard has stepped in. The last time I checked, the National Guard had given over 250,000 vaccinations across the state. We have brought in a contractor to stand up some of the higher capacity vaccine clinics that you saw in places like Rock County and Burnett County and La Crosse County. We're now pivoting that to be more of a mobile resource where we can plug in, where we see those gaps. So it really is a matter of just continuing to look at the map, identify the gaps, talk to local partners, figure out what the tools are that are in the toolbox, and go roll out that next set of strategies as we need to meet the particular needs on the ground as they may appear.
Okay, let me just stay with you, Karen. Just remind people what the status is for, just in case there's any misconception about booster shots and shots for children.
Yeah, absolutely. So a couple things on the booster front, and I will absolutely welcome my healthcare provider colleagues to jump in on any of this. So in terms of, we began with additional doses, so third doses for people who are immunocompromised and have very serious forms of immunocompromised status. So that within 28 days of their primary vaccination series being concluded, they could get that third dose. We now are on to boosters, which have been fully approved for Pfizer. So for people who have received the Pfizer vaccine, and we have groups of people, starting with people 65 and older, people living in long-term care settings, people 50 to 64 with underlying certain, again, specific underlying medical conditions. That's everyone who should get a booster per CDC recommendations. We also have groups of people who we'd strongly recommend that they consider getting a booster, but really maybe in consultation with their own healthcare provider. So that's younger adults, 18 to 49, with some of those same underlying medical conditions. That's people who may be at increased risk of exposure because of their job. So perhaps they work in a healthcare setting, or they work in a correctional facility, or they work in a grocery store. They work in a setting where they're in constant interaction with members of the public, where vaccination status of other people isn't well known, where masks may not be worn. And those are people who we really do want to protect with that third dose. We know that the FDA is beginning its consideration of boosters for Moderna and for Johnson & Johnson. We'll know more about that yet this week. So more to come. And then in terms of children, right, kids 12 and up today are eligible to be vaccinated with the Pfizer vaccine. A thing that I really want to underscore for, parents who might be paying attention, who maybe haven't gotten their children vaccinated yet, is we are seeing very high rates of COVID infection among children right now, in part because we have so many younger kids who still cannot be vaccinated, and because our vaccination rates in that 12 to 17-year-old group are not as high as they need to be. And so really important to check in with your child's pediatrician and make a decision to get that child vaccinated. We do know that data has been submitted for vaccinating kids 5 to 11, again with Pfizer. That'll be considered at the end of October, the 24th or so, I believe, is when that next round of consideration is happening. So this is all going to happen in lightning speed relative to the development of other vaccines, and lots to pay attention to. It really speaks to the complexity of the information ecosystem that we've all been talking about, And it speaks to the reliance that we're going to continue to have on our healthcare partners to really be those trusted messengers, to do that proactive communication with their patient panels, and really make sure we can connect people to the right information so they can make the right decisions for themselves and their families.
Right, and you would recommend that, people, parents should still go get their kids the flu shot.
Absolutely. Thank you for saying that. Yes, let me just spend 30 seconds on the flu shot. One thing I'll say about vaccination rates overall, one thing I think we have learned through this is getting vaccinated is a habit. And it's a habit that people, it seems, have or they don't. So one of the things that we looked at early on was how did our counties look in terms of rates of flu vaccine historically as compared to COVID vaccination rates? And it should surprise none of us that the counties that are kind of leading the pack in COVID vaccination are also the counties that traditionally lead the pack in flu vaccination. So I think that tells us something, again, about sort of the culture, the tendency, maybe the access to resources in some of those places. In terms of flu, what we know nationally is that about half of the country says they're likely to get a flu shot. To the comments that were made by my colleagues earlier, that's not going to be good enough. We are going to have to do better than that. And I know from having signed my daughter up online at a pharmacy just the other day for her flu shot, the flu shot is here, it's available, it's everywhere. We recommend everyone 6 months of age and older be vaccinated with the flu shot by the end of October. So let's see what we can do to get that done.
Okay, now we're going to move on to some audience questions that were submitted when people registered. And this one's about workforce at the healthcare systems. Again, a lot of healthcare workers are leaving the job, not because there's a vaccination mandate, but because they're burned out because of the stresses. And I'm wondering how you're dealing with these workforce issues and how acute they are. So let's just, I'm going to go to the three health system managers here. Let's start with Dr. Turney at Marshfield Clinic. What's the workforce situation and how are you grappling with it?
Sure. Thanks. That is a good question. And I would start by saying that, rural healthcare has been in crisis for over 10 years. So we've had workforce issues for a long time. And then you add the challenges that we've experienced with the pandemic. It has certainly caused us a great deal of concern and worry. Our workforce are, as Chris pointed out, they're very committed to what they do every day. They support each other very strongly. And they will do what they can to take care of the patients and meet the needs of the patient in our communities every day. But it's exhausting. Many of them have become sick. They've had family who have been sick. They have to take time off to help them. So I think the stress, the cumulative stress, actually, if you think about it, it's post-traumatic stress disorder in many circumstances. And then you add the complexity of people being critical of what they do and the care that they provide, and the around the political divide that does exist with COVID. So, there are many things that we do, but I'm not sure that we've met all the needs of everyone in our organization. But we do have many programs that support our workers through our human resource department and through behavioral health. We found that our staff in the medical ICU were really challenged when they were attacked very publicly on social media. And in fact, one social media received 5 million views criticizing some of our staff by name. Now that hits hard for people that are doing the best they can every day. So we brought in one of our psychologists who's spending time with them and testing and developing ways for them to cope. And whether it's time off, whether it's change in shift, whether it's childcare support, whether it's financial support, we're doing everything that we can to support our workforce right now, and we'll continue to do that.
Okay, let's just quick question though. How do you recruit people if there's been a rural workforce healthcare workforce crisis for 10 years? How do you go recruit or solve that crisis?
I would say it's not easy. Yet we do it in, a multi-pronged approach. We work with medical schools in the state of Wisconsin to bring students and residents into our communities to learn what it's like providing care in rural Wisconsin. We do have our graduate medical education program. We work with nursing schools, including the University of Wisconsin, Stevens Point and Eau Claire. But it's not just the clinicians that are tough to recruit. It also includes people in all of our shared services. So I think one opportunity that the pandemic has created is that the opportunity to recruit people that can work offsite and may not be located in the community where they're providing services. That's much more challenging, however, for those that are in direct patient care and need to have hands-on with the patient in the room with that encounter. So it's something we work on every day. We spend a great deal of time on, and we're competing with some great health systems in the state to secure the workforce that we need to provide the care that's necessary.
Okay, let's go to Chris Woleske, the president and CEO of Bellin Health. What's the workforce situation at Bellin Health, and how are you grappling with it?
Same. We're really busy. We are still catching up for services that were deferred during the pandemic, and so we've really never had that slowdown in the summer months that we would normally have. Our workforce has been very taxed, not just by COVID, but by just the sheer volume of services for all of the communities that we serve. And so how we're addressing that is by bringing in additional resources. So we have applied to the state, for example, for some help. We have gone to agencies, used more travelers than we've ever used, which is very, very expensive. We are redeploying people. So individuals that their jobs may not be as essential as other jobs are being asked to learn new skills and take on new roles. All of our leaders are expected to work additional after-hour shifts, weekends, nights, taking on responsibilities that they're qualified to take on, myself included, by the way. I will be patient sitting nights and weekends when I can to help the team. We have new ways of doing our business that we continue to look at. So team-based care has been an important transformation for us, especially in primary care, and allowing people to work to the top of their license so that we make the most of the precious resources that we do have in order to meet our patients' needs. And then technology continues to be important so that we can alleviate some of maybe the phone calls that come in, or the patient encounters that could be done in a much more convenient way using that technology. And then, of course, we're still continuing to try to recruit, and we work hard at that and allowing remote workers also as much as we can. But we want to also maintain our culture and our sense of team. And so we're very careful about that.
Right. And, telehealth could be an answer, but if telehealth went way up, then it's dropped down, and you have to have good broadband to have good telehealth. I mean, you can call people up on the phone, but it's not quite the same. Okay, Dr. Raymond, what do you think about this workforce issue it's not just hitting here in Wisconsin, it's hitting all across the country?
Yeah, I think it's an urgent crisis for our country right now. And the approaches that Chris and Dr. Turney mentioned are very sound. And I think it starts with supporting the people that you have on your team now. And that's paying increased attention to burnout and mental health issues, quality of life issues, and doing everything you can to support them, to create the team environment that Chris talked about. And then from a public policy perspective, advocating for people to practice at the top of their licensure and competency, but also having physicians assume somewhat of an atypical role, which is being advocates for the responsible expansion of the scope of practice and licensure of non-physician providers. And I think this is particularly important in under-resourced urban areas and in rural Wisconsin. And MCW is proud that we're partnering with other organizations like Bellin and like the Marshfield Clinic to really champion non-physician providers as frontline healthcare providers. And I think that ultimately is going to be one of the major tenets of a solution that we could have.
So you're talking about physician's assistants, essentially, right?
Not just PAs. Our pharmacy school at MCW is relatively new, and we teach our pharmacists how to do physical examinations so that they can participate in a responsible triage in settings where there may not be a physician, a PA, or a nurse practitioner immediately available. And we're also using lay mental health providers that can also decant some of the chronic care of patients and use the precious resources that we have of people that maybe have more training in a more efficient way. So that, to me, is really, we have to rethink who can deliver care and where and when they can deliver it.
Okay, Secretary Timberlake, I guess, it's a natural question. What can the state do? What is the state doing in terms of this? Because it is a statewide issue. We just had, outlined here. So what is the state doing on this front?
Yep, couple of strategies I would name. First, we do have a network of volunteer healthcare providers that are able to be accessed. This is one of those systems that, was stood up long ago to respond to an emergency that was, I'm sure, much smaller in scale and much shorter lived than the one we are managing through. But nevertheless, when we do hear from healthcare providers or long-term care providers that they are challenged with some staffing resources, that's one of the first places we go, and we're very grateful to those volunteers that have signed up on that system. We also have really adopted every one of the regulatory flexibilities that are within our control to offer in terms of, for example, some shorter training courses for certified nursing assistants, some ability to make sure that we can have hospitals and long-term care providers expand their footprint into perhaps unused space or previously used space. I realize you still have to find the staff to staff those facilities. We have earlier in the sort of last fall surge, and now again, we also have some contracts in place to acquire some additional staffing resources from around the country. That said, we know that we're all, as someone said to me, fishing in the same pond, right? It's what we are trying to access here in Wisconsin. It's also what Michigan and Minnesota and Florida and Texas and everywhere else are doing to try to meet their own critical staffing needs, but nevertheless, we have to do what we can. And then I would say on the sort of medium to longer term horizon, because again, this, as you pointed out, Jeff, this is a problem that's existed well before the pandemic. One of the first things that Governor Evers did upon coming into office was convene a task force on caregiving, because he really understands the need to be investing in our paid and our unpaid caregiving workforce, if you think along that whole continuum of care. And while the legislature opted not to move many of those ideas forward, we do have the opportunity through the American Rescue Plan Act to be making some investments, particularly on the long-term care side of the house, in a career ladder for some of those direct care workers, in some additional training and professionalization of that workforce. And that is relevant to this discussion because, as all of these healthcare leaders will tell you, one of their biggest challenges in terms of managing their own capacity is to be able to move patients out of a hospital setting when they no longer need to be there. So everything that we can be doing at a state level to be working with our long-term care partners and the staffing challenges that they have there as well is a part of the solution to the hospital and health system, both capacity and staffing challenges that we've been talking about.
All right, here's another question, and this one's for Dr. Raymond. Dr. Raymond, how do you feel about rationing care, prioritizing patients based on COVID vaccination status?
Well, that's a very tough ethical issue. And fortunately, here in Wisconsin, we've been able to manage our surge capacity without rationing care, especially based on vaccination status. On the other hand, when we have a surge like we had in November, or we're trying to deal with pent-up deferred care now when we're having another significant surge, we do have to defer and delay some types of care. And so we are making those decisions based on the urgency of whatever care needs to be administered. And so when our hospitals are full of COVID-19 patients, we may not be able to deliver the timeliest of care to people that need elective surgeries, cancer care, heart care. And so those are very, very tough decisions. But at this point in time, I don't believe anywhere in Wisconsin are we rationing care based on vaccination status.
Let's stay with Dr. Raymond here. We had a huge, surge here with the Delta variant, but we see that seems to have peaked, correct? And so we're maybe looking, we have a little respite here.
Well, I love the DHS website. It's really one of the best in the country. And I always look forward to Wednesday afternoon because I think we get our most reliable numbers after the weekend lag on Wednesday. And we also have county level data. So I would say it looks promising that we're reaching a shoulder, maybe starting to have a plateau, but check the DHS website this afternoon at 3:30 to get the best information, but probably there. We're probably
okay. Secretary Timberlake, can you give us an exclusive?
A sneak preview. No, I just work here, Jeff. I don't have those data. What I will say, so there's, as with all things with the pandemic, right? There's, let's be optimistic and let's be cautious at the same time. And I know that that's Dr. Raymond's point. So as we look, if you look at our case curve, which I'm looking at right now, we saw a similar kind of, we had an upswing and then it looked like it was going down last September and then it just shot up for last fall. And that's the fall surge that everyone's talking about. What we're seeing now is, I agree, the beginnings of what looks like a plateau to a downward trend. But let's also remember we are plateauing right now at a very high level of overall cases, right? So the reason when you look at Wisconsin and the whole country on the CDC's map, every place in the country basically is red. And the CDC is looking for 100 cases per 100,000 or less to take a county out of the red status. Nobody's there in Wisconsin or around the country. In our state, we are on average in the 600 to 700 cases per 100,000 still. So we're 6 to 7 times higher right now than the CDC says is a high level of infection. So the point is, maybe we've plateaued, maybe we're coming down, but we gotta come down farther to be able to say that we've truly kind of crested this wave. So let's hope that Dr. Raymond's right. Let's hope that curve continues on the downward slope, but we all have things we can do to not just hope, but to cause that to happen.
Okay, so we're kind of running out of time here. I want to have some closing thoughts, but I want to have it surrounding this question. What is what's your outlook for the short-term horizon here? If we have peaked, but it peaked at a high level still, what's your outlook for the short-term horizon? What really worries you on this short-term horizon? So let's start with Dr. Turney on that one.
Thanks, Jeff. Well, first of all, I appreciate the comments from all the panelists and bringing us together. But I think the one thing that was said earlier is that we learned we are not really good at preparing for or investing in things that we can't see. And no matter what we do to prepare for a pandemic, I think that there are going to be gaps that occur, and we're going to have to try to figure out how to manage it before we reach the point of desperation. Because when we talked about things like supplies and supply chains, when we talked about the workforce, when we talked about the public health infrastructure, when we talked about the communities and the desperation that they had, we saw it all. And so building the foundation is not just about healthcare. Building that foundation is about really working with our communities, really supporting our society, creating the equity in healthcare that we've already talked about, and really realizing that in order to we have to work from the ground up on these issues because they're really fundamental. Healthcare is just a piece of it. These are fundamental problems that a Band-Aid, that there is no quick fix, but there is, I think that whole in society that needs to be fixed is something that we need to, we now have better awareness of. And I think that by investing in that around the equity, inclusion, diversity, and the social determinants of health, that we can be better prepared for the future should something like this, appear again.
Okay, thank you very much for joining us, Dr. Turney. Okay, Chris Woleske of Bellin Health. Chris, what's your short-term outlook here? Are you optimistic, pessimistic, and what do you think is the What are you really worried about out there?
I think the number one concern on my mind in the short term and currently is workforce. And not just the shortage, but their well-being and their ability to carry on through this with, no real end in sight. We've heard this before where, oh, good, the numbers are going down, only to have that be a temporary situation as well, and they go right back up again. I am concerned about the potential for new variants that as we continue to see the spread that Karen Timberlake talked about, we know that there is the potential for new and even more devastating variants to come out of this, and that concerns me. So I think, really I'm hopeful because as Dr. Turney said, I do think that our Midwestern values in the end bring us together, and generally speaking, we find a way to come back to each other, and that's what I'm hopeful for.
All right, Dr. Raymond, what worries you or what gives you hope in a short term here?
I think we focus a lot on the worries, and obviously we're starting with a very high case count here in Wisconsin. And Delta, despite rumors to the contrary, seems to take 2 to 3 months to have the surge end. So we're going to be experiencing high case counts here for the next couple of months. And as Secretary Timberlake said, we actually can control how quickly the surge ends by practicing mitigation measures like masking, social distancing, and avoiding crowds, and most of all, getting vaccinated. So hopefully people will take that seriously. But there is some good news on the horizon. There are 3 oral medications that are either have asked for emergency use authorization or will within the next couple of weeks. And that could really help relieve the stress on our health systems. If people are able early in their symptomatology to take a pill for a few days and reduce their hospitalization and death risk by 50%, that's very promising. And I think by the end of the calendar year, at least one of the medications, probably the Merck product, will be approved for oral use. And I think, I won't call it a game changer, but I think it'll be a nice tool in our armamentarium.
Right, but rapid testing would sure help to go along with that.
Absolutely.
Yeah. Okay, so Secretary Timberlake, you have the last word. How often do you get the last word, right?
Not too often.
What's your short-term outlook here? Hopeful or pessimistic? Or pessimistic?
Yep. So I will say in the short run, I think I lean more hopeful than not. I don't know that I'd, come to work every day if I didn't. So I think that we know what to do. We're doing it. It's a matter of staying the course and continuing to engage more and more people in the conversation. The thing I want to just say as a note of appreciation is I really am seeing more and more leaders of different kinds, our healthcare leaders, some school officials, parents groups, faith leaders, others really stepping forward to say, hey, listen, COVID-19 is a problem for our communities. It's affecting our kids, it's affecting our families, it's affecting healthcare, it's affecting the workplace, and it doesn't have to. And so the fact that we have more and more of those voices out in the mix, whether that's again in mainstream media or on social media or any other channel, that is part of what's going to help us sort of build that resolve that we really need to get all the way across the finish line, not only with this current Delta surge, but with whatever will follow it.
All right, well, I want to thank all of you for participating here today. It's really enlightening for me, and maybe we can reconvene this when we have moved down the ways a little away and can look backward with a little more certainty. But anyway, I really appreciate you doing this today. So thank you, Secretary Timberlake from the Department of Health Services. Thank you, Chris Woleske of Bellin Health, the president and CEO there. Thank you, Dr. Raymond, the Medical College of Wisconsin president and CEO. And thank you, Dr. Susan Turney of the Marshfield Clinic. Also want to thank our sponsors for this event. And want to thank Hush Blackwell Strategies, ARP Wisconsin, American Family Insurance, Walmart, Xcel Energy, Wisconsin Hospital Association, and Wisconsin Healthcare Business Forum. Again, a reminder, if you want to sign up for our free daily healthcare report, You can do that at wisbusiness.com. You can get more information on COVID and other health issues at the Department of Health Services website. And you can look at wispolitics.com for future events. So this is Jeff Mayer signing off for today. Thank you very much for being part of the program.